I'm Chip Lewis, the founder and CEO of 64 Insurance Group. We're going to do a little Medicare 101 for you guys. And I think if I were you guys, I would be asking, why is this guy putting on this free Medicare webinar? What is in it for him? There's always a catch, right? Well, there is something in it for us, but it doesn't come out of your pocket, and yet it does benefit you. So let me try to explain. We are an insurance brokerage, which means we are contracted with all these different carriers, United Healthcare, Humana, Aetna. And ultimately, you are going to have to choose one of these carriers or these insurance companies to administer your, whether it be a Medicare Advantage plan, a Medicare supplement, a prescription drug plan. And so what we do is shop them for you. We're completely unbiased to these, which carrier we choose or help you choose. And we are paid, but it's by that company. And your rate doesn't go up. You don't pay more. So it's a way that we can do the hard work for you without you calling a bunch of different companies and seeing which one is best for you. Selfishly, we want you on the best plan because we don't want to lose you as a client if you choose to go with us or let us help you. We've been in business for about 15 years, so I'd like to think we know what we're doing by now. Things are always changing in this industry, and they continue to change. So we're constantly having to take new certification. So trust that we know what we're talking about, and we want to make sure you're in a good spot. We are local. We have offices all across the Southeast. One is north as Wisconsin. I consider it north. I think a lot of people call it Midwest. So if you know anybody in Oshkosh, Wisconsin, we've got a guy for you. But we have locations in Savannah, Bluffton, Augusta, Statesboro, Charleston, Greenville, South Carolina. I know I'm missing a few, but we have local offices where you can go in, look someone in the eye, and get answers to questions. We are not in a call center with headsets on in cubicles. We are real people with a real location. We are not going to pressure you. I know you guys are getting bombarded big time, whether it be in your mailbox or your phone or email or wherever, Facebook. And maybe we're doing a tiny bit of that, but hopefully not too much. But we will not harass you or pressure you in any way, but we are here for you. Our team is great. I love our group of guys and gals. I promise you we'll do everything we care for you. And again, just to reiterate, there is no fee for our service. We are paid by the insurance carriers that you choose. And here's some lovely pictures of some of our team members that are in some of the different locations. And here's Keone Tyhook. He's our client service director. More than likely, you will speak to this fella at some point in time. He's great, and we'll be answering a lot of your questions throughout your Medicare journey. So what are we going to cover today? We're going to go over Medicare A to Z, give you a high-level overview of Medicare. We'll cover premiums, deductibles, co-insurance, how to avoid penalties. I know this is always a big topic. Nobody wants to pay a penalty. Should you transition to Medicare? Should you stay on your employer coverage? Can you stay on your employer coverage? When should you apply for Medicare? How should you apply for Medicare? Which option do you go with? Medicare Advantage, Medicare Supplement? What are the pros and cons of each? We're going to cover all of that. What is Medicare? It is federal health insurance for folks that are 65 and older, typically. So when you turn 65, most folks have the option of getting Medicare. And if you're under 65 with certain disabilities, you may be eligible as well. Started in 1965 by President Johnson. I'm going to go over original Medicare. And while it's good to know what original Medicare covers, take it with a grain of salt, because ultimately there are going to be two options, either Medicare Advantage or Medicare Supplement, that 99% of folks go with. So this original Medicare could change depending on what you do here. So I'm just trying to simplify it. Don't feel like you have to learn everything, because you always can schedule that one-on-one consultation with us. Everyone's situation is unique, your finances, your health, everything. So there is no cookie cutter solution for everyone. Okay, let's talk about Part A of Medicare. Part A of Medicare, part of original Medicare. Part A is your hospital coverage. So most of you guys have worked 10 years of your life. I'm assuming you or your spouse have worked 10 years of your life. You have earned Part A, and you do not have to pay a monthly premium for Part A as long as you have worked 40 quarters or 10 years of your life. And so if you're wondering what that little Medicare tax was coming out of your check every month for all these years, this is what you were paying for, Part A of Medicare. So how does Medicare Part A work? Again, take this with a grain of salt because it will change depending on one of these two options that you take, Advantage Plan or Medicare Supplement. But if you were to just keep Part A and you were to go to the hospital, you would have a $1,632 deductible, and that would cover you for the first 60 days in the hospital. And after day 60, you would start paying $408. Don't get too hung up on this. I'm going to reference back here in just a second to this. Medicare Part B. This is your doctor's office portion of Medicare. Part B, doctor's office portion or your outpatient portion of Medicare. It does cost a monthly premium, $174.70 that most people will pay. If you are on Medicaid, you may pay nothing. If you make over a certain amount of money, you could pay more for Part B. But the standard premium is $174.70 a month. So once you pay your premium, then you will have a deductible, an annual deductible of $240. So you'll pay the first $240 at the doctor. Once you meet that deductible, then Medicare Part B kicks in and covers 80%, and you would be responsible for the remaining 20%. That is Part B in a nutshell. This could change based off of what we do, whether that Medicare Supplement or Medicare Advantage plan. So I'll reference back here in just a second. This is an IRMA chart. This is the income related monthly adjustment amount. This is if you make over a certain amount of money, you could pay more for Part B, and $103,000 if you're filing an individual tax return, or $206,000 if you're filing a joint tax return. And they base that off of modified adjusted gross income. They look back 2 years. So I know that's a lot, but if you feel like you're in one of these income brackets or you're making over that amount of money, definitely want to schedule a consultation with us so we can help you dive into that and see how much you will actually be paying for Part B. Part A and Part B enrollment. Who should enroll? Almost all of you should enroll into Part A, hospital coverage. Almost everyone in here. The only reason we believe that you should not enroll into Part A is if you are contributing to a health savings account, an HSA. If you have a high deductible health insurance plan through your employer, oftentimes they will have an HSA option. And so you wouldn't want to take Part A if you're going to continue working and keep that plan. There can be some tax implications there and some sort of penalty, or you lose the tax credit. A couple of things there, but just long story short, if you're not contributing to a HSA, you should enroll into Part A. It can only help you. It can't hurt you, even if you're keeping your employer coverage. Okay, who should enroll into Part B of Medicare? Your doctor's office portion. If you have access to creditable coverage, like employer coverage, and the government or Medicare deems coverage creditable if you have more than 20 employees at your employer. So if you have a small group plan, if you're the owner of a company and you just got a small group plan of like 3 or 4 employees, that would not be creditable. So you would likely need to move to Medicare and enroll in Part B, because if you didn't, you could be penalized for not taking Part B. So it really boils down to, do you or your spouse have access to creditable coverage, which is oftentimes employer coverage. If you have access to employer coverage, you can delay Part B, say, no, thank you. I'm not going to take it right now. I'm going to wait. And you can keep going without penalty. But if you do not have access to that type of coverage, then you do need to take Part B, or you could be penalized. When should you enroll? Typically 3 months prior to your birthday month. If you were born in December, you would want to start the application process to enroll into Medicare. Let's see, November, October, September. So September 1st is when you can actually start enrolling into Medicare, Part A or Part B. So just to give you a heads up, if you are born in December, say December 14th, your Medicare will start on the first day of your birthday month. So in that scenario, it would start on December 1st. It doesn't start on your birthday like a lot of people think. It starts the first day of your birthday month. So that's when you should enroll, about 3 months prior to your birthday month. Now, how should you enroll? If you're drawing Social Security, then it's very simple. You will automatically be enrolled into Medicare. They will send you your Medicare card about 3 months prior. Nothing you need to do except for when you get that card, you know, call us, call someone, a brokerage. We would prefer us, but you need to start shopping those plans. And so that would be a good time to do it. If you are not drawing Social Security, then you definitely need to apply yourself. And it's pretty shocking to me that the government, Medicare, does not send out anything saying, hey, you got to do this, you're going to be penalized. But it is the case. So you need to actually take action yourself, and you want to do that 3 months prior. So how do you do that? You need to do it through the Social Security Office, Social Security Administration. You can do it online, ssa.gov. You can do it in person. I wouldn't recommend that, but you definitely have to apply yourself for Part A and Part B, and we are happy to help with that process as well. A few things that are not covered by Medicare: dental, vision, and hearing benefits are not covered, gym memberships, prescription drug coverage, long-term care insurance. So these are all things that you have to get on your own, whether it be through a Medicare Advantage plan that covers a lot of these, or getting a standalone plan for some of these. And we'll dive more here in a second. Long-term care is something that a lot of folks kind of forget about, and it's something that you want to look at before it's too late for sure. And we have a few partners that we could refer you to that can help with that. So remember, I said there are two options: Medicare Supplement and Medicare Advantage. We're going to talk about option one right now, Medicare Supplement, also known as Medigap. There are two popular plans that we're seeing. These are the only two plans that we're really dealing with right now. There are other Medicare Supplement plans, but for the sake of time and the fact that we know these are the two most popular, we're going to talk about these. So let's talk about a Plan G supplement. If you were to get a supplement, you have to have Part A and Part B. Okay, you can't just have Part A and get a supplement. You have to have Part A and Part B to do either of these options, either Medicare Supplement or Medicare Advantage plan. So just keep that in mind. But if you were to want a supplement, Plan G, you would pay your monthly premium. So they do have a cost. For a female, it's about roughly $112. A male, roughly $125. It depends on your state and zip code. So just giving some ballpark numbers there. But if you get a Plan G supplement, then this is how it works. You would basically never have a hospital bill again. It picks up everything that Part A does not pay. So remember when I was telling you about Part A, and it has this deductible each time you go into the hospital of $1,600? Well, that Plan G supplement will wipe that out, and it would wipe out any coinsurance that you could have after day 61. So essentially no bills at the hospital as long as you pay your monthly premium. Okay, now let's talk about the doctor. So remember, Part B, you got to pay your monthly premium, but there's that $240 deductible when you go to the doctor annually. You have that $240 deductible, and then Medicare kicks in and pays 80% after your deductible, and then you're responsible for 20%, right? Well, the Plan G supplement will actually eliminate that 20%. So after you meet your deductible, you're off the hook. It will pay the remaining 20% that Medicare does not pay. There are no excess charges with a Plan G. We'll get into that in just a second. There's some foreign travel benefits. You get like $50,000 if you're in another country, and it's an 80-20 deal. So the plan will pay 80% of your costs, your healthcare costs internationally, up to $50,000. Okay, so Plan N is becoming more popular. It's also a Medicare supplement, and the rates are a little bit less, as you can see. And that's because it doesn't cover quite as much. Let me explain. So a plan in, let's say it's roughly $90 a month for a plan in. It does work the same at the hospital. It'll cover everything that Medicare doesn't pay at the hospital, just like a plan G. So no more hospital bills as long as you're paying your premium. At the doctor, it works like a plan G, whereas you pay your deductible, $240, and then it will pick up everything that Medicare doesn't pay, except there is a copay at the doctor, whether it be a primary or a specialist, of $20. So you pay a $20 copay. It does not go towards your deductible. If you go to the emergency room, you would have a $50 copay. And there is something called excess charges with a plan in that you could be susceptible to. And excess charges, we do not see them very often. I don't know that I've ever seen an excess charge, but it's something to be aware of that they could come in the future. And it's essentially when a doctor's office charges more than the Medicare allowable amount, then there's these excess charges and you can get hit with up to 15% of these. So it's something to be aware of. We don't see it, but I just want to put it out there that who knows where our healthcare system's going. And I could see that maybe they would try to use that to get more money. Frankly, I don't know how else to say it. So this is kind of your main options within option one, Medicare supplement. This is what a Medicare supplement looks like. You pay a premium, but you really don't have bills other than the deductible at the doctor or these copays if you go with a plan in.
Yeah, so Part B, drugs that are administered in a hospital, doctor setting, or infusion center will fall under your medical. Okay, that's very important with supplemental insurance. So if they're taken orally, you pick up a prescription and you take it yourself at home, or outside of that care, it would go under drug coverage. But if it's administered in those settings, it would fall under your medical. And that becomes obviously very, very pertinent if you're taking, some infusions, chemotherapy, radiation, those kind of things.
Yeah, the chemotherapy is a big one, for sure. That's where the supplement can really save you some money, because if you look back at Part B, if you're paying 20% of the Part B drugs like chemotherapy or infusions, there's no cap on Part B. So no max out of pocket with this. 20% of $1 million is 200,000. One thing that is extremely beneficial if you go with a Medicare supplement, it's going to pick up that 20%, and obviously could be tremendous savings there. What are advantages and disadvantages to Medicare supplements? Some of the advantages are there are no doctor networks. Anyone that accepts Medicare, as long as Medicare will pay its piece, the supplement is required by law to pick up the rest of it, or whatever, however your plan is built. They're required to pay also. Medicare supplements are a true secondary insurance. So Medicare pays, and then the supplement comes in and pays. It follows Medicare. So as long as your doctor takes Medicare, good to go. We see less billing issues or claims issues. Doctors typically like it when folks walk in with a supplement because they know they're going to be able to bill Medicare pretty easily. And this plan, they're not dealing with an insurance company. They're billing Medicare, and the plan is coming in, picking up what Medicare doesn't pay. Travel, Medicare is a federal plan, so it's accepted across the United States of America, and you can take your supplement with you wherever you go. As long as Medicare will pay, it will pay as well. There is no underwriting when you are new to Medicare, so you are guaranteed to get the supplement. Whenever you are either turning 65, or if you delay Medicare because you keep your employer coverage, say you waited to get Part B later down the road because you kept employer coverage. Well, basically, whenever your Part B starts, that will start the clock. You have 6 months to get a Medicare supplement without them asking you any health questions. So that could be very important, especially if you had any health issues going on, because after 6 months, say you started with Medicare Advantage plan, and then down the road, you said, you know what? I have this knee surgery coming up. I really want to get a Medicare supplement because it'll pay for everything. Well, it's not going to work like that. They won't approve you because they're going to ask you some health questions, find out you had that going on, and then would most likely deny you. So just keep that in mind. The best time to get a supplement, if you're going to, is get it kind of early, no health questions. It's a lot easier to downgrade to the Medicare Advantage plan, if you will. And we'll go over that here in a second. So what are some disadvantages to a Medicare supplement? Premiums do go up as you get older. They could stay the same. I've seen them drop, but it's been 4 or 5 years since I've seen that happen. Rates typically do go up. Now it's impossible to predict, but we can look at the past 5 years and get a good guesstimate of what's going to happen. We've seen them jump higher recently, just with cost of living and healthcare costs. So somewhere between 5 and 10%, I would say, is what you're looking at on an annual increase. A disadvantage, or something you need to be aware of with a Medicare supplement, is prescription drug coverage is not included. Part D, prescription drug coverage. D is in drug. So you have to buy that separate plan. It's just another cost. Dental, vision, and hearing benefits are not included, so you have to buy that separate plan as well. Now let's talk about option 2, Medicare Advantage, also known as Part C or Plan C. These are the plans that you see all the commercials about, and they're trying to give you everything. They'll give you dental and vision, and they'll cut your grass and give you a brand new car. I'm kidding. They promise a lot of benefits, and some of that is true. They do give you a lot of that. But let me kind of explain what a Medicare Advantage plan is. Remember, option 1, that Medicare supplement, it was more like a true secondary insurance. It came in and picked up what Medicare did not pay. Medicare Advantage plans essentially replace your Medicare. They become your Medicare. So Medicare says, hey, Medicare Advantage plan, we will give you X number of dollars every month as long as you take care of this Medicare beneficiary. But the deal is you have to give at least as good a coverage as original Medicare. Okay. And so let me kind of go over some of these things. Many of the plans have $0 premiums of the Medicare Advantage plans. So remember, you have to have Part A and Part B to get this plan. So you're typically not paying anything for Part A. You're paying $174 for Part B. And now you have this $0 premium Medicare Advantage plan. One of the cool things about these Advantage plans is they have predictable copayments. Remember when we were talking about Part B, where you could pay 20%? Well, that, 20% of a lot is a lot, and, it's all relative. But these Advantage plans typically have predictable copayments. Most of these do include Part D, prescription drug coverage. So you don't have to go buy that separate plan. They have prescription drug coverage included. Many of them have dental, vision, and hearing benefits, over-the-counter benefits, gym memberships. And one of the things I like the most about them is they have max out-of-pockets. Typically, we're seeing these plans have max out-of-pockets between $6,000 and $8,000 a year annually. And that's very important when we go back to what Brett was referencing earlier with chemotherapy. If you were to need chemotherapy, this Part B drugs could cost 20%, and having a max on this can be extremely helpful and save you lots of money. Okay, so I'm going to give you an example Medicare Advantage plan here, and I just kind of averaged a few plans together. So this is no specific company. A lot of them have $0 premiums. Typically, you'll see something like $5 at the primary doctor. So instead of paying that $240 deductible with original Part B, and instead of paying 20%, you would go straight into just paying a copay. Many of these Medicare Advantage plans eliminate the deductible. You do not have a medical deductible. So you go to that doctor, pay $5. Go to a specialist, it's typically around $30. The hospital, they have per day copays on most of these plans. So instead of paying that $1,600 deductible for per visit, with original Medicare Part A, they build it out where you pay a per day copay. And this example, I put a $300 per day copay, but it maxes out at day 7. So if you go for 1 day, you'd pay $300. If you go for 2 days, you pay $600. And, typically that's a lot better than paying $1,600 per visit. And then MRIs, everything's a la carte. You're kind of seeing here. It's like you got to have a menu. You're like, what am I going to buy today? Oh, I'm going to buy an MRI, a CT scan. Typically, we see around $275 for an MRI, CT scan, outpatient surgery, which I think is an incredible deal, really, is $375. If you think about it, if you went and had a total knee operation, or back surgery or whatever, that could cost you a ton of money if you're paying 20% of the cost with just original Part B. But if you have a Medicare Advantage plan, you would have that predictable copayment. So $375 is a pretty good deal. And again, I already referenced max out of pockets. That can really protect you when you get into some of these big ticket items like infusions or chemotherapy, or if you just have a really rough year and you're in and out of the hospital a lot. What are some disadvantages to Medicare Advantage? Well, there are doctor networks that you need to be aware of. There are PPO plans and HMO plans, and I'm not going to dive into all the different types, but some of them require you to go to certain networks like an HMO. And then there are plans like PPO plans, which you can go in and out of network, but you may pay more if you go out of network. So just know that there are some doctor networks that we need to be aware of. The good thing is Medicare Advantage plans and their doctor networks are just getting stronger and stronger. So particularly in the Savannah market, we don't have a problem really finding doctors that are in, or same with Augusta, Charleston. Networks are getting stronger and stronger. Claims and authorizations. While that option one, Medicare supplement, they don't really run into any problems with claims or authorizations. Medicare Advantage plans sometimes, because it's an insurance company that's administering your healthcare now. If you needed a surgery, well, this insurance company might come back and say, hold on, doc, before you try to perform the surgery, have we tried a medication or have we tried some physical therapy? They don't want to spend their money on these things. So just know there could be some pushback there. We don't see it a lot. I'm just trying to give you kind of worst case scenarios on some things. Referrals could be needed for in certain situations with the Medicare Advantage plan. There are specific service areas for Medicare Advantage plans. You won't see typically a federal Medicare Advantage plan. They are kind of specific to regions. And if you had an emergency while you were traveling, across the country, you could go to the hospital, you could do whatever you need to do. But if you were traveling and wanted to go see a doctor while you're out of town, and I don't know who does that, unless it's an emergency, but you may pay more because you're outside the service area. Let's go over, when I go to buy a car, and I give this example a lot, when I go to buy a car, it's like, just tell me the price. They're luring you in saying, hey, it could be this price. And then you get to the table and tax tag and title and all the things, right? So we tried to do this for you. We tried to give you, when you get off this call and you can say, okay, yeah, I think Medicare supplement would cost me about this much and Medicare Advantage would cost me about this much, kind of all in. So we broke it down for you. So let's talk about Medicare supplement option one. Remember, Part A doesn't cost you anything as long as you work 10 years of your life. You've earned that. You paid in all these years. So Part A, your hospital coverage costs $0 a month. Part B, your doctor's office portion of Medicare costs $174 a month for most people. Again, you could pay nothing if Medicaid. You could pay more if you are making over a certain amount of income, but typically $174. Your supplement would cost you about $115 a month, depending on if you're male or female. Prescription drug plan, let's just guess that it's about $11 a month. Again, there's a lot of them right now from 50 cents all the way up to 100. I think it's a nice safe number, this $11. If you were to add a dental, vision, and hearing plan, $45. So you're looking at about $350 all in if you go this Medicare supplement option. Knowing that $350 amount is important if you're on employer coverage right now and you're like, man, and you're going to continue working. You may say, should I stay on my employer coverage or should I transition to Medicare? Well, it becomes a math problem. Are you paying more than $350 a month for your employer coverage? If you are, well, you should probably go to the supplement, because the supplement, you won't really have any out-of-pocket costs after you pay your premiums. Whereas with the group plan, usually you've got deductibles and things like that. So just one way to think about it here. Okay, Medicare Advantage. So what does the all-in cost? Remember, Part A doesn't cost you anything because you worked all these years. That's your hospital coverage. Part B costs $174. You got to have A and B to get the plan. Part C, which is the Medicare Advantage plan, many of them have $0 premiums. Part D, which is your drug plan, your prescription drug plan, most of these plans have it included. So you don't have to buy that separate plan. Part D is included in most of these. Most of these plans have dental, vision, and hearing benefits included. So you don't have to go buy that separate plan. Now, one thing, so if you just tally all that up, $174 is all you're paying just for Part B, really. Now you're having all the costs at the doctor, you have the co-pays, you're still paying out of your pocket for everything you have done. But as far as your monthly premium, that's what you're looking at. We did add on here hospital indemnity, which I think is an awesome plan to add on to your Medicare Advantage plan. And just to show you how it works, typically you can get them for around $30 a month. And basically what it does is eliminate your hospital cost, or you can build it to do so if you do it right. So remember this $300 a day at the hospital, and it was for days 1 through 7. So we could build a hospital indemnity plan, which would actually reimburse you per day. So we would build it to match this. So you pay your premium each month. And if you were to go to the hospital, you'd owe $300 to the hospital. Well, this hospital indemnity plan would write you a check for $300. So it's pretty cool. They reimburse you, you pay your bill, and it's a way to eliminate that hospital cost if that was a concern, which of course is a concern. You don't want to have to come out of pocket. You want to come out of pocket as little as possible, I guess is what I'm saying. So here are your two kind of out the door tax, tag, and title costs: Medicare supplement versus Medicare Advantage plan. Veterans, if you're a veteran, thank you so much for your service. We really appreciate you. And a lot of veterans have unique plans which they deserve and have earned, obviously, for you and your families. Well, there are some extra benefits for veterans that a lot of folks are not aware of. Some plans will give you money back on that Part B premium. Some plans will give you dental, vision, and hearing benefits that you do not get with the veteran plans. Some will give over-the-counter benefits. So I guess what I'm saying is there are a lot of different scenarios here, and it's hard to dive into each one because every situation is a little bit unique for you. But I think it's a great idea to still set up a consultation and see if there's something else extra out there for you. And a lot of times there is. And one of those, the big things being, hey, get some money back on your Part B premium, because essentially these plans that you already have are doing a lot of the work. So Medicare says, hey, let's give you some money back. You have to have Part A and Part B because you have to have both to get the Medicare Advantage plan. But that Part A and that Part B money is going to go to the Advantage plan. And I guess there's a lot of ways that you could phrase this, but you have to have Part A and Part B. It replaces it, but you still have to have it because there's a bucket of money that they need to spend. So, gosh, that's a real tongue twister of one there. How do I apply for the hospital indemnity plan if I have the Advantage plan? So whenever you go to enroll in the Medicare Advantage plan, hopefully it's with us. We can, build you out a plan and tell you how much it's going to cost, and we can help you enroll into that as well. What are the next steps here? And I was joking earlier. I asked one of my guys to build out a very simple, extremely easy to read slide, and he came up with this algorithm here that's got my head spinning. But anyway, I'm going to walk you through it. So number one, I'd say the next step is schedule a one-on-one consultation with our team. We can dive into your unique situation. Again, you don't pay for it. We're not going to pressure you. If it makes sense for you to stay on your employer coverage, we will tell you that. There are a lot of agents and agencies out there that will pressure you into going to Medicare because they want to make a sale on the Medicare Advantage or the Medicare supplement plan. But we take pride in shooting you straight and helping you make that decision. It might make sense for you to delay Medicare. So you can use this QR code to schedule an appointment. So you schedule a consultation. We will dive into your situation, do the fact finding thing. see if you need to go to Medicare. If you do, we will help you apply for Medicare. Again, that can be pretty tricky, and we are happy to help guide you on that. Once you apply for Medicare, then you've got to choose Medicare Advantage or Medicare Supplement. There is this third option that we rarely see anyone go with, which is original Medicare just with a prescription drug plan. It's totally an option that you could go with, but I think there's a lot of reasons why I wouldn't personally, and we can go over those in your consultation. So what do you get after that? This is not a one-time thing. A lot of agents out there will, enroll you and you can never get in touch with them. That's not how we operate. You'll have access to our entire team. You'll be given a dedicated tech support line. Many of you got a reminder text from it here earlier that you can text that, ask a question 24 hours a day. I'm not saying we're going to respond 24 hours a day, but when we get back in the office, we will definitely get back to you. And it's not just, let's say Brett is your agent. It's not just him looking at these. It's our entire team that can help get it answered quickly. You have this lifetime concierge service that we are very proud of. But every year there's open enrollment. And during that time, plans change, your prescriptions change, your doctors have changed. So you want to review that coverage every year. And we're, again, not just going to enroll you and never talk to you again. We want to get you scheduled and review your coverage so we make sure you're in a good spot for next year, whether it be with a new insurance company or staying with the same one. We're unbiased. And, there's times where we pivot to new plans each year, depending on how the benefits look and how your drugs look and doctors and all of that. And then after that, enjoy your retirement. Don't stress about this stuff. Let us do it for you. You don't need to remember a single thing in this whole presentation except the fact that we are here. We can help you. You don't have to pay for our services. Schedule a consultation. Let us take it off your plate. I know this is overwhelming. Put your trust in us, and I promise you we will take very good care of you.
How far in advance should we be talking as far as Medicare coverage and so forth? So as Chip mentioned, you can begin applying for Medicare, original Medicare 3 months prior, but it's never too early to start. That's obviously why we came up with RU64.com. We want to be talking to you well in advance. Although we can't necessarily write coverage before that 3-month period, we can begin identifying what your coverage should look like, give you some solid pricing, at least identify do we want to go supplemental, Medicare Advantage, what that's going to look like. So never too early to schedule a consultation, at least be nailing down pricing and how it's going to fit your needs.
Yeah, we love to talk to folks early. I think there's a lot of people out there that they're just trying to talk to you at 64 and 9 months because they want to sell you something. We know this is a long process. We're happy to educate you early, and we're just hopeful that you give us a call back down the road. So it just goes back to us trying to keep it low pressure and just being confident in what we do.